This is a very interesting case. This had come to me. This was a 19-year-old baseball player, actually making his way up into the baseball world. And him and his dad, they had a pitching machine out in the backyard. And he decided to take about 150 swings at 100 miles an hour because they were playing with the new jugs machine. So the kid was in the batting cage, ball be coming in at 100 miles an hour, and he swung, and he swung, and he swung. And he did this 3 or 4 times in one day because they got the new machine. They were all excited. What happened was he ended up having trauma from this, ended up getting hurt. He went to seek help from an orthopedist, and the orthopedist ended up putting him in over-the-door traction, which caused a lot of problems. From that, it got to the point where he was starting to get nauseous. And then the orthopedist said, I'm going to send you to a physical therapist. Physical therapist came in and started treating him for about 3 to 4 weeks, and all sorts of motion. Now, this is an injury from our perspective, to save time, is a dural injury into the cord. And the therapist started manipulating and causing further trauma. From this, it got even worse to the point where patient's name is Zach. Zach had to function with a device that they invented for him, a board with a pillow, with his arms like this. I'd like just everybody to stand up a second. Just everybody stand. Put your arms out like this. Stand up, Charles. Charles, stand. Like this, and now turn your head 5 degrees to the right. That would cause, you can sit down, that action would cause nausea, vomiting, motion. His parents had to hire an aide so he could go to the bathroom. He couldn't get out of bed, he couldn't do anything. This is a 19-year-old athlete. That's how bad it got. He sought the help of a neurologist. He went out to California, all sorts of injections into the neck, all sorts of experimentation as far as I was concerned. Prolonged therapy, all sorts of different therapies, just kept on getting the kid worse. He basically came in a catatonic state where he lived like this, and just tilting the head would cause nausea and vomiting. Went to the Mayo Clinic. Mayo Clinic got him 1,000 times worse. Came back, and he was finally referred into us. Okay. You have these notes, right?
You have the article.
Okay, you have the article. Basically, it was a very, very sad situation in this case, and I had to figure out how to help him. And what I'm going to do with the time that I have here is just expand your horizon a little bit. He couldn't swallow. So imagine being, he couldn't even swallow. And they had to actually, he was actually taking food through a bag in order to survive. The first thing I had to help fix was his ability to swallow without causing nausea and vomiting. And what I did was developed and invented a whole slew of techniques from him. I was actually blessed to help him and to come out with all this incredible creative stuff. We would take water, put it in a cup, and have him sip it. As he was swallowing, what I would do is start literally, first place, I'd put my hands on him, and that would cause a nausea. So just the amount of pressure. I would literally go in between the SCM and the esophagus and find the different areas that were damaged from all the therapies that he had, and started to soft tissue type manipulation and so forth to recreate that with a whole tremendous nutritional program to help the tissue get back to normal. And I developed a whole technique where a couple of months down the road, where as I was adjusting him, we would add rotation. And as I would, the whole trick here was have him swallow the water that he couldn't do as I'd adjust him from the anterior here. And the amount of force was what you would use on a baby. And literally get him to the point where he could rotate without throwing up and without getting nauseous. And I used this particular procedure while adjusting him in a seated position. He would get treated anywhere from 4 to 6 hours each treatment. And most of the treatment was geared to help him from all the injuries that the other physicians had incurred. And this went on and on and on, and I'm glad to state that Zach now can hit a golf ball, throw darts, shoot a basket, and a lot of the stuff in what I did to get him better was all based on blocking and all based on cranial work in all different positions, which we'll be teaching the class on that. If you go to the next slide, Jeff. The nausea really had gotten so bad that his whole life, he was like a bubble kid. And the fact that we got him to the point where he could move his arms, for 2.5 years he had an aid to go to the bathroom for urination and to have a bowel movement, that he couldn't even wipe himself. And all of these positions, what I did was I would literally put him in all these different positions and unwind the dura, as I call it, and see where the problems were, again, against his ability to swallow. So I would always use the swallowing mechanism to actually help him, because that was the cause of the injury. I can't begin to tell you, when he went out to California, the neurologist there, he would get 200 injections in one visit of whatever they were injecting him with at the time. So you can imagine you have a tissue that's damaged, and now they're literally playing darts on his neck and probably damaged it even further. So the whole concept in treatment was I had to literally recreate, by nutrition, recreate the tissue so it can heal and get the cranium working. And we developed so many cranial techniques just to get him to that point. Zach can now drive a car. There's not much that he can't do at this point. And what I'd like to say about this is, what I'm very excited about this, is that he's going to be applying at NY, New York Chiropractic College, has a nutritional program. So I got him into the nutritional program, where he is in a 3-year nutritional program to become a nutritionist now. So it's really kind of exciting stuff. And just this concept here, and the reason why I wanted to spend time to you to understand this is very important when patients have cervical disc problems. Any neurology in the front, the swallowing mechanism, which Dr. DeJohnette in category 2 scenario, the hiatal hernia, I was lecturing in Las Vegas, and there was the Bodywork show, and I had some great pictures. There's a great picture of the phrenic nerve and the vagus nerve coming down to the diaphragm with all the other organs gone. And you see it in this torqued position. It was just like a sign from God. I walked out there and I saw that. I says, "That's Zach." And I took an illegal picture of that. But now you could understand, when you see something like that, the power of what you do with CMRT. It is such a powerful tool. But what I'm adding to the puzzle here is your ability, just the swallowing mechanism, how important that is in treating a cervical disc. So think about all the cervical discs you treated, and there's a whole other function. And what happens is the patient would take the water, and I would literally test the swallowing mechanism. And we'd always get to the point where the kid would get nauseous. And the minute that I got the part that was nauseous, I would go and correct the areas associated with that. So it was 4 to 6 hours each treatment. Okay, I'm done. All right, thank you.